Okay, let's begin our class. Last class, we have studied the introduction of antibiotics, and we have known we divide antibiotics divided into five kinds. And first kinds inhibit cell wall synthesis, such as the penicillins, cephalosporins. The second kinds inhibit cytoplasmic membrane synthesis, for example, polymyxin. The third kinds some drugs inhibit bacterial protein synthesis, for example, erythromycins, tetracyclines, and aminoglycosides. The fourth kind, antibiotics, inhibit DNA or RNA synthesis, such as quinolones and rifampicin. The last kind inhibit bacterial folic acid synthesis, such as sulfonamides or TMP. This class, we will study the details. We will study the first antibiotics. The first kind antibiotics, beta-lactam antibiotics. I think each of you know the history of penicillin. And in 1928, Fleming observed that a mold contaminating one of his cultures caused the bacteria in its vicinity to undergo lysis. Broth in which the fungus was grown was markedly inhibitory for many microorganisms and looks like a green because the mold belonged to genus Penicillium. So Fleming named the first antibiotics the antibacterial substance penicillin. So we have the first antibiotics used in clinic and especially used in the World War, save lots of lives. Penicillins, cephalosporins, they share the same mechanism. So in fact, penicillins, cephalosporins, we call them beta-lactam antibiotics. Beta-like antibiotics inhibit the synthesis of bacterial cell wall and are considered bactericidal agents. The mechanism of penicillin we have studied last class, and just now we also reviewed, inhibit bacterial cell wall synthesis. Beta-lactam antibiotics also trigger the activity of autolytic enzyme. So let's study and review the mechanism of penicillins. Inhibition of cell wall synthesis to inactive transpeptides and then interfere with the biosynthesis of the peptidoglycan and at last inhibit bacterial cell wall synthesis. Penicillin bonding to its protein. The target is PBPS, means the penicillin bonding proteins, and to inactivate PBPS present on bacterial cell membrane, which are bacterial enzymes involved in cell wall synthesis and maintenance of morpholic feeders. So, inhibit cell wall synthesis, and then means the cell wall, the shape of cell wall, the shape of cell determined by cell wall. So, kill the bacteria. The wall outside the cell wall, the water flew in cell, and the cell, bacterial cell expansion, and then kill the bacteria. So, penicillin, cephalosporins, they are beta-lactams. They are bactericidal agents. Okay. But in clinic, you will find use penicillins or use cephalosporins several weeks and then no use, ineffective. So we call this drug resistance. Use beta-lactams have drug resistance because inactivation of antibiotic by lactams. So that means beta-lactams be destroyed by this enzyme. That also means that if we can use some drugs inhibit beta-lactamase, means can prolong the effects of beta-lactam. So later in clinic, some drugs can inhibit this enzyme and then can prolong penicillins or cephalosporins effect. Classification of beta-lactamase includes penicillins, also includes different generations of cephalosporins and other beta-lactam antibiotics. So this class, we will study the first kind, penicillins. Penicillins have the basic group, beta-lactam, and then here add different group have different new penicillins. Same with penicillin, cephalosporins. Cephalosporins also have this basic group. We call this beta-lactam. And same with penicillin. Here, we add new groups. We'll have new cephalosporins. So today we will start. That means cephalosporins and penicillins, they share the same mechanism, inhibit cell wall synthesis. So that also means they share the same pharmacological effects and the same interactions because they have the same basic group, beta-lactamase. Okay. The first kind, beta-lactamase, are penicillins. Penicillins also divide into different subtypes. The first kind, penicillin G, natural penicillin. Natural penicillin G because this drug is narrow spectrum, so we also call penicillin G is the narrow spectrum penicillin. Natural penicillin G, we couldn't oral administration, so we add a new group. In penicillin G, and then we have penicillin V. So we call this drug acid stable penicillin, especially penicillin V. And this drug we can oral administration. We can oral administration penicillin V, but penicillins they are still narrow spectrum. And then we add a new group in penicillin G. We have broad spectrum penicillins such as amoxicillin, such as ampicillin. But this drug, we use the drugs several days or 1 week, 2 weeks later, drug resistance occurs. So we add a new group in penicillin, and then we have penicillinase resistance penicillins. But this drug can kill most positive and most negative, but couldn't kill gram-negative. So we add new groups in penicillin. We have anti-pseudomonas penicillin and anti-gram-negative bacterial penicillins. Can you understand the classification of penicillins? Natural penicillin is a narrow spectrum penicillin. And these penicillins means semi-synthetic penicillins. Okay, so this class we will study the first antibiotics, the natural penicillin, penicillin G, narrow spectrum penicillin. Penicillin G, before we study penicillin G, we should use some professional term to describe penicillin. Penicillin G, the first word is narrow spectrum. The second word is bactericidal. Okay, bactericidal arrays. Penicillin G, it is the first antibiotic. And we use penicillin G, the drugs we use unit. Okay. Pharmacokinetics of penicillin Z. Penicillin Z is apt to be inactivated by gastric acid. What's the meaning? To inactivated by gastric acid, be destroyed by gastric acid. That means we couldn't oral administration penicillin G, so we have to use penicillin G in injection. So the commonly administration method of penicillin G is intramuscular injection or intravenous using intravenous injection. Penicillin G, natural penicillin, short acting, half-life only 0.5 to 2 hours. So that means short acting. So in fact, in clinic, use penicillin G each day. Each day should 4 to 3 times intravenous using or intramuscular injection. Distribution. Penicillin G can be distributed widely, generally. In normal couldn't pass BBB, blood-brain barrier, but if the patients they have meningitis and penicillin G can pass blood-brain barrier to kill the bacteria in brain. So very useful for meningitis patients. And excretion, yes. More than 90% penicillin G be excreted in kidney. Okay. Penicillin G, natural narrow spectrum penicillin, and it is the bactericidal agent, can kill. We have studied what's the meaning of bactericidal. Means not only inhibit arrest but also kill growth. Okay. Can kill the first one, kill gram-positive organisms, such as gram-positive cocci, hemolytic streptococci, pneumococci, non-beta-lactamase producing staphylococci. And not only can kill gram-positive cocci, but also can kill gram-positive bacillus, such as Corynebacterium difficile, such as Clostridium tetanus, such as Clostridium perfringosin. That means can kill these gram-positive cocci and bacillus. Means later we can use penicillin G to treat this sensitivity bacterial infection and as the first choice antibiotics. Penicillin G also can kill some gram-negative cocci, such as meningococci, such as gram-negative gonococci. For gram-negative bacillus, no use. So why we call penicillin G is the narrow spectrum antibiotics. The reason is here because for gram-negative bacillus, little activity. So penicillin G is the narrow spectrum, only can kill limited bacteria. Except gram-positive cocci and bacillus, penicillin also can kill Spirocita. So means penicillin G can use to treat Spirocita infections. Okay, so the pharmacological effects of penicillin G just now we have studied, and it's very important. Maybe for you a little difficult to remember lots of bacteria's name, and I need you to master this antibacterial spectrum of penicillin G. Very easy. Gram-positive cocci, gram-positive bacillus, gram-negative cocci, and Spirochetas. In fact, maybe you can write like here, like this. Very, very easy. Gram-positive cocci, bacillus, gram-negative cocci, and Spirocheta. Clinical using. used to treat just now we mentioned this bacterial infection and as the first choice agent. Penicillin Z is the drug of first choice for treatment of sensitive bacterial infection. Includes the first one, pneumococcal infections. So pneumococcal infection includes pneumococcal pneumonia, pneumococcal meningitis, pneumococcal laryngitis, pneumococcal rhinitis, and so on. So the first one, the first clinical using of penicillin Z is the pneumococcal infections as the first choice. The second clinical using of penicillin Z used to treat streptococcal infections and as the first choice antibiotics. Streptococcal infections such as streptococcal pharyngitis, streptococcal laryngitis, scarlet fever, otitis media, endocarditis, and streptococcal pneumonia, meningitis, and so on. So, the second clinical using of penicillin Z is the first choice agent for treatment of streptococcal infections. The third one. The third clinical using is the gonococcal infections. Do you know gonococcal infection? Gonococcal infection, most of them, they are sex transmission disease. Sex transmission disease, and so it is a secret infections. And in China, lots of male patients of the infect gonococcal infection, so they don't they are shy go to the hospital, so they go to some secret local clinic. And the local clinic gave them some antibiotics, but in fact, drug resistance, no use. Why? Because you should know, okay? So we started penicillin, you should know. Penicillin Z therapy is still the first choice for all types of gonococcal infections. Is still the first choice for all types of gonococcal infections, although strains have increasingly resistant to penicillin Z. So the third clinical using of penicillin Z, gonococcal infection as the first choice for each patient in different states for all types of gonococcal infection. Penicillin Z is still the first choice. Even drug resistance, penicillin Z still the first choice agent. Okay. Number 4. The fourth clinical using syphilis. Syphilis, do you know syphilis? And in fact, yes, it is one kind of sex transmission disease and very difficult to treat. So just now we mentioned the patients they shy for this disease, so they go to local clinic and use some expensive drugs. But in fact, you should know, penicillin Z is the most effective treatment for each stage of syphilis. Maybe you're confused why the patients they don't use, why the doctors they don't use, don't give the patients penicillin Z, because penicillin Z the cheapest. Understand? So the some local clinic, secret clinic, give the patients lots of different special new antibiotics. But in fact, we should know for each gonococcal infections, for each syphilis infection, all types of different states of the patients, the first choice agent still the most effective drug, still penicillin Z. Understand? Doctors, I hope you can remember this. Though in clinic, we have lots of new, more expensive drugs. Penicillin G is still the first choice for these patients. The fifth clinical using of penicillin G is the diphtheria. Do you know diphtheria? Penicillin Z is used in diphtheria to eliminate the acute and chronic carrier states. In the meantime, specific antitoxin is used for treatment of diphtheria. Diphtheria this year rarely occurs because I'm sure when you were a young child, each of you inject, maybe in your country, you call this DDP, DDT. You inject antitoxin when you were a young child. And so this diphtheria rarely occurs. If the diphtheria occurs, the patients, do you know the pseudomonas membrane in Churchy? Pseudomonas membrane in Churchy. So the patients, the classical symptom is the dyspnea. The patients, like this, breath, short of breath, and because the narrow pseudomonas membrane in the trachea, and we give penicillin Z used to treat diphtheria to eliminate the acute and chronic carrier states. In the meantime, specific antitoxin is used for treatment of diphtheria. Okay, next one. Tetanus. Tetanus, yes, rarely occurs. But if we have these patients, specific antitoxin is used for treatment of tetanus, and at the same time, we should use penicillin G as the first choice drug. Okay. Number 7, gas gangrene. Gas gangrene. Yes, this gas gangrene rarely occurs. It always have this gas gangrene means the serious series for earthquake because this bacteria in the deep soil. So only after the big earthquake and then we have this bacteria. So after the earthquake and then maybe we have this gas gangrene infection and the patients have two amputation. But don't forget, doctors, penicillin G is still the first choice agent for gas gangrene, for anthrax. So this rarely occurs. If we have these patients, we still use penicillin G. Do you know this? Garlic, yes. We call garlic is the 10% soil penicillin. Soil penicillin. So useful to inhibit bacterial or virus infection. Thus, now we studied penicillin G's clinical using. Used to treat pneumococcal infection, streptococcal infection, gonococcal infection, and syphilis, and diphtheria, and tetanus, gas gangrene, and anthrax as the first choice for infections of sensitive organs infection, still as the first choice. Okay, so the adult section of penicillin Z. Penicillin Z, the commonly adult section is the allergic reactions. Hypersensitivity reactions to the penicillins occur in 1 to 10% of patients receiving these drugs. Although these forms of penicillin can cause hypersensitivity reactions, the reaction can range from a mild skin rash or edema to life-threatening allergic shocks. So, how to treat? Hypersensitivity reactions includes, do you remember? I have explained the adult reactions for you. Mild patients, skin rashes. urticaria, and then fever. Moderate allergic reaction includes angioneurogenic edema, acute circumscribed edema, serum sickness, and the worst sequelae is the allergic anaphylactic allergic shock. So mild, moderate, and serious allergic reactions. 1 in 50,000 patients treated with penicillin died from allergic shock. And this allergic shock, we can use two words to describe. The first word, fast, very fast. Maybe in 1 to 2 minutes, the patient suddenly allergic shock. The second word is hugely, is dangerous. And so we should know how to save the life and how to prevent, how to save the life. Okay, so just now mild patients after use penicillin, such as skin rash, angioneurologic edema, and serious patients. The worst sequelae is the allergic shock. So how to prevent prophylactic therapeutic measures of anaphylactic reaction? The first one, ask history. Ask your patients, oh, do you have you used the penicillin? Yes, I used. Oh, no, I don't use. I never used. So the first one must ask a history. Ask a history. And then also should ask, do you have the breakfast? Have the lunch? If the patient's empty stomach, they must eat something because empty stomach also induce allergic reaction. So the first one, ask. In Chinese, we call this 一问, ask history. And then second, test, skin test, do the skin test. And just now we ask history. Some patients, they said, oh, I used the penicillin. I never have penicillin. I never have allergic reaction. Though they say that they never have allergic reaction, we still should do the skin test for these patients. If the patients say that they have used the penicillin, they have allergic reaction, we couldn't give penicillin G again, penicillins, cephalosporins. And only they say that they never have allergic reaction, we can do the skin test for them. So we do the skin test for them, especially the first time they must do the skin test. So we take 0.1 milliliter, 0.1 milliliter penicillin normal saline, and then subcutaneous injection here for it, okay, and wait 15 to 20 minutes. Wait 15 to 20 minutes. 20 minutes later, here, no nodular, no edema, no red, and then that means no allergic reaction. We can use penicillin or cephalosporins to our patients. If the patients use subcutaneous injector normal saline 0.1 milliliter, and then 20 minutes later, here, red, or eats, or nodular, or the diameter more than 0.5 centimeter, means 5 millimeter, more than 5 millimeter, means they have allergic reaction. We couldn't give penicillin G. Understand? So the first time the patients use penicillin G, we should do the skin test for the patients. And the patients use the drugs 3 days, and maybe they withdraw the drug. If they withdraw the drug more than 3 days, or they change different drug shops penicillin, they should do the skin test again. Understand? Doctors, you must pay attention to this. Must do the skin test for the patients. Though we do the skin test, we ask the history. Even 二是 first ask, second test. Even we ask the history, we do the skin test for our patients. But still, some patients they still have allergic reaction. Once allergic shock occurs, do you remember the first choice agent? Is adrenaline. Adrenaline should be administered immediately. So we must remember subcutaneous inject adrenaline to save the life as the first choice agent. And then we give hydrocortisone, glucocorticoids as the adjuvant therapy. Understand? So how to save the life for allergic shock? The first choice agent is adrenaline, and then the second choice we give hydrocortisone. Understand? Don't forget this. Okay. Just now we studied the complete adverse reaction of penicillin G is the allergic reaction. Use penicillin G is except allergic reaction also have other unwanted effects such as hyperkalemia, such as local pain at injection sites. Yes. So if you have the experience, you have this pain. And then penicillin encephalopathy, especially in elderly patients, long-term use, overdose use, maybe penicillin pass cross blood-brain barrier induce encephalopathy. The patients excited, insomnia. So you should know we give the penicillin G overdose or use the too long time. The last adverse reaction is the Hermes reaction. Hermes reaction, when the patients, the syphilis patients, use penicillin G, and because penicillin G too powerful to kill the syphilis spiral theta, so the patients, some patients, they high body temperature, tremor, and high fever. We call this Hermes reaction. The reason is penicillin G too powerful because syphilis to treat syphilis, the spiral theta before the spiral theta died and release lots of androtoxin, so induce this Hermes reaction. So for this reason, we treat syphilis patients use penicillin G. We should, in the initial stage, use the low doses penicillin G and then increase the doses because have this adverse reaction. Okay, this class we studied the natural penicillin, penicillin G, narrow spectrum penicillin. We studied the penicillin G's pharmacological effects, clinical using, and adverse action. But penicillin G is the narrow spectrum. We couldn't oral administration, and use several days have drug resistance. So we add new groups in penicillin G, and then we have semi-synthetic penicillins. Next class, we will study semi-synthetic penicillins and we will study cephalosporins. Okay, class is over. See you next time.